Hi, welcome to another episode of Live Healthy Miami Gardens Live. Happy Tuesday, everyone. My name is Melissa P. Dunn. I am the CEO of MD Marketing Network. I'm also a member of the Live Healthy Miami Gardens Communications Subcouncil. And once a month, we have a conversation around COVID-19 and the flu, particularly encouraging folks to live healthy and to also get boosted or vaccinated. So today we are having a really what I hope to be a very interesting conversation. We are speaking about cancer and COVID-19. It is Cancer Awareness Month this month, and so we are amplifying the discussion around some of the challenges that cancer survivors face, particularly in this age of COVID-19. And we are very honored to have with us today a hematology oncologist from Memorial Health System. Dr. Meri Muminovic was born in Yugoslavia, but she grew up in Michigan. She is all the way from the Detroit area, you guys. In fact, she did medical school at the American University of the Caribbean in St. Martin, and then she did her residency in internal medicine at Detroit Medical Center in Michigan. Now, Dr. Mori has joined the Memorial Health System family in July of 2021 as a hematology oncology fellow. And she is currently in her second year of fellowship. She has a very strong interest in solid malignancies, and she absolutely loves living in Miami. Dr. Murray, how are you?
I'm good. How are you? Thank you for
I'm
having
doing.
me.
Oh, of course. Could you do me a favor and say your full name so everybody gets it for the record?
I'm Dr. Meri Muminovic.
Okay, all right. So I'm going to call you Dr. Mary so that I don't butcher your name. It's such a you here. Thank you for giving your time to this discussion. I know how busy you are as a fellow.
Of course. Thank you for having me.
So tell us a little bit about yourself. You went to medical school in the Caribbean. How was that experience?
I think it was the best experience ever. I got to experience the culture, different ethnicities and different, medical conditions that oftentimes we don't see in the United States. So I think it made me a well-rounded physician. And prior to, finishing my internal medicine residency and coming to hematology oncology.
Oh, yeah, that's really good. That whole bit that you mentioned about being able to work with diverse communities. The city of Miami Gardens is a very diverse community, and we have a really active Caribbean community. So it's, I think, good that you had that experience in St. Martin.
Mm-hmm.
Tell us something that maybe we don't know about you in general, like that not a lot of people know about you.
So I've lived in 4 different countries prior to, the United States being one of them, but, throughout my whole life.
Okay, so I guess Yugoslavia, the U.S., St. Martin, and what's the fourth one?
Germany.
Germany. Oh, I lived in Germany too, actually.
Yeah.
I lived in Osterholz for like 3 years. My dad was in the military, so.
Yeah, I lived in Stuttgart for about 2 years.
Oh, that's wonderful. Stuttgart is a beautiful city. So we have that in common already.
Yes.
So why did you choose oncology? I'm just curious.
I chose oncology because it's the only specialty where, you can actually, you see the patient in front of you and you can actually make a difference in their life. It has a lot of variety of research and different between, diagnosing and medications and treatment. And it gives you that one-on-one attachment to your patient, to potentially cure a patient from their disease.
And so for those of us who may not be familiar with hematology oncology, could you tell us a little bit about what exactly is that specialty?
Sorry, you were breaking up a little bit.
Yeah, no, I was saying for those who may not be familiar with hematology oncology, could you tell us a little bit about what that specialty entails?
So a specialty entails working, so hematology is a blood, basically diagnosing and treating blood like cancers or benign conditions, and oncology treating cancer. And so it both worlds. So I just see patients in conditions that
Yeah, you know
do have
what? We
cancer.
might be having some technical difficulties here because you're
Yeah.
breaking up. Dr. Mary? Yeah, I think we're having some
Yes.
technical I think we're having some technical difficulties. You're breaking up a little bit. Could you try saying something else?
So in terms of so with hematology, are you able to hear me better?
Yes, I'm hearing you
Okay.
perfectly clear now. Yes. So you were telling us
Mhm.
what you do for a job. Like what is hematology oncology exactly?
So in terms of hematology, I'm able to treat benign conditions like anemia, thalassemia, and sickle cell disease. Also malignant conditions like leukemia, lymphoma. With oncology, it can also it's usually solid tumors, but it also can be malignant, like I said, with a hematology aspect. So I see diverse populations with all types of cancers, and and also benign conditions. So it gives me a lot of variety of different treatment options and diagnoses.
Oh, wow. That's so interesting. I didn't know that. I didn't know that a hematologist would work with folks with sickle cell and also with thalassemia. That's so
Mhm.
interesting. As well as cancer. Good to know. I mean, sickle cell and thalassemia is something that impacts a lot in the Afro-Caribbean community.
Yeah.
Yeah. So let me ask you a question, Dr. Murray. So if somebody's a cancer survivor, right? Are they at a higher risk of being diagnosed with COVID? Like is there a correlation between COVID and cancer?
So there is a correlation. So anytime COVID-19 is in the spectrum, having certain conditions puts you at high risk. Examples include diabetes, chronic kidney disease, autoimmune diseases, and also even having a prior history of cancer or a diagnosis of cancer automatically puts you in a severe risk of getting COVID-19 and a more severe risk of getting an infection.
So then if you have cancer, if you are a cancer survivor, then you really need to be hyper vigilant then, it sounds like.
Correct. I just published some research in the past year with one of my mentors, Dr. Reyes. It was called Mortality and Prognostic Factors in Hospitalized COVID-19 Patients. And basically, we looked at over 4,800 patients that came through the Memorial Healthcare System, where about 265 of those patients had malignancy. And looking at those patients that actually had malignancy had a higher chance of mortality, both in and out of the hospital, and irrespective of their age, comorbidities, or anything like that. So that being said, that's a very pertinent prognostic factor in getting COVID-19 and actually having severe symptoms and severe infection from it.
Wow. So basically, your research showed that cancer patients that were in the hospital had a higher risk of dying from COVID than those who didn't than those with COVID who did not have cancer. Did I understand that
Correct.
right?
Correct.
Wow. And how many, you said 4,000, how many patients did you study?
So we studied 4,800 patients, but out of those, 265 had malignancy or cancer.
Wow, that's so interesting. So then there really is a direct correlation. So cancer patients really definitely need to be vigilant. Um so with this study and the discovery, the correlation that you guys discovered, what's the practical application to this that the community can kind of take away?
The practical implication would be with any type of severe illness, you're immunocompromised, meaning that you have cancer, you're under treatment, or even had a prior history of cancer, you should be more vigilant and take more precautions to make sure that you don't get these high-risk diseases such as COVID-19. Obviously, other diseases such as the influenza, things like that. You also should be very wary because, you being in that certain population puts you at a greater risk than maybe your next door neighbor that, might not have that condition.
Oh, fantastic. And what steps should folks who have cancer, what steps should they take to lower their risk or their exposure?
So anytime that there is an increased risk of infection or exposure that you see, either you're being told via your employment or you see it on TV as numbers are increasing, you really want to stay within a smaller group of people, meaning that, if there's a higher risk of exposure with COVID-19, you'd want to, limit your exposure to that. So meaning, I'd rather, if you have cancer, you had a previous history of cancer, maybe you shouldn't go out to that sporting event. Maybe you should just stay home with your family. Or if you have family, you have a gathering, maybe make it a little bit a smaller group. Or if some of your family members or friends are sick or have some upper respiratory symptoms such as cough or runny nose or any of those fevers, chills, then maybe not hang out with them for, a week or two until they figure out if they have COVID-19 or not. Because, those are some of the precautions you can take. And obviously, wearing a mask and having people around you wear masks, especially if, you're under active treatment where your blood cell lines aren't able to protect you from the illness, is a very important prognostic factor. And lastly, washing your hands, that's the first step. So regardless if it's COVID-19 or the flu, it's important to wash your hands anytime you leave your house, come back, or you're about to eat, or if you touch something, because that's the primary way to prevent illness.
What about vaccines, either the COVID vaccine or the flu shot?
So being vaccinated is the first step to protecting yourself. Vaccinations, are part of herd immunity and protecting not only yourself but our population. So making sure that you do get the vaccine. If you are getting an mRNA vaccine, it's a 3-dosage vaccine. If you get the first 2, then you want to get the third one within that 28-day period. Having a full vaccination is important. Having a partial is basically not having it at all. So it's very important to get the full vaccination. Also getting your flu shot, very important. Even if you're under active treatment, you can still get your flu shot. It's not a live vaccine, so it's not going to put you at risk for an infection, but it will protect you and make sure that you don't get sick from it.
Wow, that's so important. So I have an aunt who breast cancer, and I think it metastasized. And so we just had her 70th birthday party this weekend. And now that I'm thinking about it, I don't think any of us wore a mask. And I believe that she is in remission, but she has to go for treatment every 3 weeks. And so you have me really thinking now, Doc. I'm like, none of us, we never know. And we were all hugging on her and, making her feel special. And it was just her time. And we were celebrating her and really grateful that she was alive and around. And I remember when COVID first came out, I actually had planned to go spend some time with her, but we canceled, and she didn't travel or she wasn't around any of us for a very long time. Yeah.
Yes. Yeah.
Good to know. Good to know. Good to know. Now I'm just like, oh Lord, maybe we should have her. Maybe we should have her tested now. I mean, we're all fine, but you never know, right? That's the whole point.
Exactly.
That's the whole point. And are there any special precautions that my aunt should take? Like, she's currently actively engaged in treatment. So other than the ones that you mentioned, she's fully vaccinated. Like, she's had all of her doses. She's had her flu shot. And I mean, I guess other than the fact that we just celebrated her 70th birthday, I think she's pretty prudent, right? And she doesn't, she doesn't really do large crowds. So she's done all of the things that you just mentioned. Is there anything else that I need to have a conversation with her about?
The only other thing is if you are, if you are going to have gatherings, like I said, you don't know who has COVID and who doesn't. Some patients are asymptomatic. I would definitely have your gatherings more outside, and probably just distancing yourself, and less contact sometimes is better, because you're less likely to transmit any of the germs and things like that.
Are the symptoms for somebody that may currently have cancer or is a survivor of cancer, are the COVID symptoms any different, or are they similar? Like in the study that you had, were the symptoms more severe?
So the symptoms of COVID-19, regardless if you have cancer or not, is basically like pneumonia symptoms, because it is a type of pneumonia. So you do have cough, you can have a runny nose, you can have what's called pleuritic chest pain, where you cough and you can feel pain in your chest, sore throat, fevers and chills. But that being said, when you are a cancer survivor, or you are under active treatment, or you do have cancer currently not starting on treatment yet, that does put you at increased severe risk for getting a more complicated and severe infection. And so your symptoms might be more severe. When I did my internal medicine residency, I worked in the ICU, and oftentimes these patients that had COVID and cancer oftentimes ended up on the ventilator, because they're already immunocompromised, especially the patients that had lung cancer. Lung cancer is a specialty that I'm very interested in. And the patients that do have lung cancer, their lungs are not up to par with other patients. Even if it's a breast cancer patient, their lungs are different. You can kind of tell that they're a little bit damaged from the cancer already. And so if you add an infection on top of that, it really puts them at an increased risk for even more severe infection. Oftentimes those are the patients that get hospitalized, get intubated, and end up in the ICU.
Oh my goodness. And I don't know if this is a myth or not, but it came to my mind a while ago. So I'm going to say it, so that if it is a myth, then you can help me bust it right now. So I've heard people say that when you are put on the ventilator, that kind of increases your risk of not surviving COVID. Is that true?
That is not true. Being on a ventilator, patients get put on ventilators for two different reasons. The first reason is they're not able to breathe on their own, so the machine helps them to breathe, either because of infection or other reasons that their lungs might not be working, might be a heart condition, might be a lung condition. And so it really helps, the patient breathe. A second condition would be for air compromise. So sometimes patients, they might have been found down because, they might have had a heart attack, or they might have had a seizure, and sometimes those patients do get intubated for those reasons. But being intubated is essentially a stepping stone for the patients to get better. Every day that I did work in the ICU during COVID, I did see patients every day that we tried to wean them off the machine, meaning that you slowly decrease the oxygen that the machine is providing for the patient, and you see if the patient's able to breathe on their own. And, the more research that we had on COVID and the better therapies that we had, we saw more and more patients get off the ventilator and being able to breathe on their own. So, I don't think of it as an end all. I think of it more as a stepping stone for them to get better and get discharged from the hospital.
Thank you for clearing up that myth. So, I've heard also that if you have COVID and you're home, right, that the protocol is for you to stay by yourself, and for you to call your doctor to say that you've tested positive for COVID, and then have a conversation with your doctor. And your doctor will then advise you on whether you should go to the ER, or whether they want to prescribe something for you. Is it the same thing for a cancer patient or a cancer survivor?
It is the same thing. So I do take, call at the hospital, and especially during our peak of COVID-19, I did get a lot of patients that did call me and ask me, hey, I'm having these symptoms, or I'm not having any symptoms. What should I do? So I think it's very important that you stay connected with your physician, rather it be if you're on active surveillance and you see them once a year and you get COVID, I would still, call your oncologist and make sure that you are in communication with them and you tell them what's going on, because, they are up to date with everything. They'll be able to tell you, maybe you can just stay home and isolate yourself, or if it's something more severe, then they can definitely triage you to the best location for treatment or further diagnosis and things like that.
Okay, yeah, because I was wondering about that. I'm like, what would I do if what would I tell my aunt if she called me and she's like, oh, this is what she's experiencing? Like, I think that I would tell her, okay, call your doctor, right? And then the question comes to mind is, do you call your oncologist or do you call your PCP? Like, who, if you have cancer, like, who should be that first phone call?
I think the first phone call would be your oncologist. I think, us being very specialized in the field of cancer and this being a cancer patient, I think that would be their first and foremost phone call, just establishing that baseline. And I think your oncologist would be able to direct you, if there's further questions in regards to COVID-19 treatment or things like that we're not experienced in. Then I would redirect the patient and say, hey, maybe you should talk to your PCP and things like that. But I think, establishing that first phone call with your oncologist is the most important.
Okay, good to know, good to know. And so so the patient is, so they're feeling the symptoms, they call the PCP. I know that's the first, they call the oncologist, that's the first thing to do. What are some of the things that an oncologist could typically say to a person who is actively undergoing treatment?
In terms of they're having symptoms?
Uh-huh.
So if they're having symptoms, my first question would be, what kind of symptoms are you having? My first question would be, what kind of symptoms are you having? And depending on the severity of symptoms and depending on how many days the patient's had these symptoms, or if they're not having any symptoms, would be the next step. So obviously, if you're having high fevers, you're having chills, you're having to a point where, you're having a cough that's productive, meaning that you're coughing up stuff. Those are more severe symptoms than a patient that, might have a little bit of a headache and sore throat. So the patients that with more severe symptoms, I would definitely, and if they're having these symptoms for the past, 4 to 5 days is different if you had the symptoms only 1 to 2 days. So taking all that into account would be very crucial in triaging the patient to the best next step.
Got it. I mean, it sounds like the bottom line is, if you you have symptoms and you've tested positive, just call your oncologist and have that conversation, right?
Yep.
Are there treatments? So I know that there are treatments on the market right now for folks who may not be immunocompromised, like they don't have cancer. Is it like the same types of treatment options, or is there something specialized for folks who are also undergoing chemo? Because I mean, I imagine that some medicines don't interact well together.
So, so basically, anytime a patient has COVID-19, like I said, we look at the severity. So if you are greater than 65, if you're immunocompromised, meaning cancer patients, or if you're greater than 50 and you're not vaccinated, those are all categories that put you at severe infection, okay? So if you meet any of those guidelines, and one of them being cancer or a cancer survivor, automatically you're in severe. And so for severe infections, if you have good kidney function and if you have a good liver, then you might be recommended to get what's called Paxlovid. Okay, Paxlovid is an oral medication that is given to the patient to take at home within that week. And also depends on the timeline of the symptoms. If the timeline was less than 5 days, or if it was more than 5 days, because that will determine if you can get that oral medication. If not, if you're less than 65, if you're less than 65, you don't have a history of cancer. Or if you're less than 50, then, there's other treatments. Then you can get what's called remdesivir, which is basically an injection, or you can get the plasma, which was offered before. But for cancer patients, they would definitely, if they're within that 5-day period, they would be offered the Paxlovid medication.
Got it. I mean, it all comes down to the bottom line. Just have the conversation, right? Don't
Mm-hmm.
sit at home, suffer in silence,
Mm-hmm.
and I find sometimes that particularly with men of color that, it's like, all right, I'll tough it out. But no, call your doctor and have that conversation. And together you can make a decision about what's best for you based on those factors that you're experiencing. Yeah.
Exactly. Yep. I
Mm.
think it's very important for everyone, regardless, of your race, ethnicity, or age, or, or nationality, or anything like that. I know, growing up, I am foreign, and my parents, didn't speak good English, and sometimes they were afraid to call their doctor because they couldn't express how they felt. And, that being said, we live in such a diverse community, and, having doctors of different languages and things like that make it a lot easier for patients to express themselves and get the treatment that they need.
Yeah, for sure. And a lot of times, hospitals like Memorial, for example, I know you guys have access to translation services, so you can always get somebody on the line that can translate for the doctor if needed.
Yep.
Well, are there any support groups or resources available to cancer patients like during the pandemic or even now through Memorial?
Yeah, there's plenty of resources. The first and foremost, especially for myself, I always make myself readily available to all my patients. I do, they're able to message me on my chart. They're able to call me, and at any time I'm able to support them. We also have many support groups, both in the hospital. We also have navigators. So every cancer specialty has their navigator that they're in touch with, that checks up on them and things like that. And then we have the support ancillary services.
Is there, let's post a number or something that folks can use if they need to get in touch with Memorial, if they currently have cancer and they need additional support. We're going to put the phone number for the central scheduling area for the Cancer Institute. So that number is on the bottom of the screen. If you're currently engaged, if you currently have cancer and you want to contact Dr. Muminovic, did I say it right?
Mm-hmm. Yeah.
Yes. If you want to contact the doctor, please use that number. And certainly you can go to that link for cancer survivors at Memorial Health Systems. Doc, thank you so much for giving us your time, and for I mean, you certainly taught me something. I was one of those people that I've heard that myth about the ventilator. So I'm happy that I gave you the opportunity to bust the myth today. Any final words of wisdom that you might want to share?
I think the final words of wisdom is, being a cancer patient or cancer survivor, that is a hard condition sometimes, to have. But, with further research and further treatments that we are coming about, I think we're always one step closer to a cure. And just, having a good mentality and having a good support system like your family, I think really, advances you and puts you at a greater potential for a potential cure in the future.
Oh, wonderful. Well, thank you so much for your service. Thank you for all that you do for the community, and continued luck and hard work as you finish your fellowship. Thank you.
Thank you so much.
Oh, my pleasure. Miami Gardens, remember, you can always go to livehealthymiamigardens.com. We are indeed a trusted source of healthcare information. There's a plethora of resources available where you can access low or no cost care in the city of Miami Gardens. And I want to invite you to join us on Tuesday, the 16th at 3 p.m., where we're going to be talking about prioritizing your mental health. This is Women's Mental Health Week, and so we're going to be giving more information on that. So do join us back here for our additional COVID and flu conversation. And then, as always, the Live Healthy Miami Gardens team will be here next week, Tuesday, Live Healthy Miami Gardens Live, to provide additional information and resources to help you live healthy, Miami Gardens. Thank you for joining us. Be well.